recording?
Yes. All right, the bone joints. We already said that bone joints, it is actually a place where two bones meet. Two bones, where they meet. Okay, so very important. Place where they meet is bone joints. All right? And the joint is very important in the sense that it allows for movements. It allows for movements. Because without joints, we're not going to be able to contract, flex and extend. So the flexion and extension helps to provide for the movements. And the other thing is, it protects the softer organs. Okay? So very important. So understanding joints or bone joints, it provides us the anatomical function or the study of the muscles, muscular functions. All right? Now, the thing that we need to understand is the fact that two bones are meeting doesn't mean they're going to be movable. All right? So some joints is just slight movement, some much more movement, some no movement at all. All right? So very important, no movement at all. All right? Arthrology, we're talking about the science of joints, function and dysfunction. The function and dysfunction. Kinesiology, we're studying about the musculoskeletal movements. When we say musculoskeletal, what are the things that are involved? Muscle and skeleton. Muscle and skeleton. Okay, so very important. All right, so how we name joints, it depends on the names of the bones that are involved. Names of bones involved. For instance, radial ulnar. Remember we talked about radius and ulnar. Also between atlas and axis. What do we call these joints? Atlantoaxial joints. Atlantoaxial joints. Atlantoaxial joints. Because they're meeting there. Okay? Atlantoaxial joints. Alright? So, how we classify joints, it depends on what is binding them together. So the structure, the binding structure. So classifying joints, okay, it involves, we classify them based on binding structure. Binding structure, which means what is binding them together. Binding structure. So based on this, we have bony, we have cartilaginous joints, okay, we have fibrous, then we have a synovial. Now, out of this bony, cartilaginous, fibrous, synovial, the most movable is this, most movable, and complex joints, most movable and complex joints, and typically common. Okay, because we have a whole lot of movements in our body. Most movable is complex and typically common. All right. So we have subcategories. Under all of this, there are subcategories. All right, again, understand that what binds them together helps us to classify them. So for instance, bony joints means there isn't anything between, it's just bone to bone. Okay, bone to bone. Fibrous joints by fibers. Cartilage by cartilage. Synovial, this is one that is much more complex. Okay, much more complex. All right? Much more complex. Yeah, we're still gonna look at it. I just gave a look at it. All right. So when we're talking about the bony joints, we're looking at bony joints right now. When we talk about bony joints, we can also call bony joints synostosis or synostosis. Okay, or synostosis. Yes, which means it's just bone, just bone, nothing else. Or synostosis. that's another name for bony joints. Another name for bony joints, synostosis. Okay, synostosis. All right. Now, there isn't no anything between the joints. The two bones touch. So we said the two bones ossifies, which means they kind of fused together. Fused together. That's ossifying. Ossifying means they fuse together. So they fuse together, and as a result, they form a single bone. So we just know that something was there before, but all of a sudden we cannot actually see it again. It's almost like one single bone, right? So an example, when we talk about the left and right mandibular joints. Now, in infants, you're gonna see the mandible, all right? That is the right part, the left part. There is a part that an infant that you can see that is forming together, okay? But eventually it's fused. That it's almost become like one bone, okay? All right? So the sutures in elderly, we're talking about the sutures, right? What are the types of sutures? Sagittal, coronar or frontal, lambdoid, and squamous. All right, the squamous is between what's and what's? Okay, the temporal and parietal. Temporal and parietal. Okay, while the lambdoid is between what's bones? The lambdoid. The lambdoid is between what bones? Lambdoid suture. Occipital and
occipital and the axial. The back. The
occipital and parietal. Exactly. Okay. So very important. All right. Also, with aging, with old age, an example is what? The first rib and sternum. The first rib and sternum. The first rib and sternum fused with old age. Almost like we cannot actually see where the sternum, where the rib is actually joining with the sternum. And we say sternum has how many parts? Three, which are the body, manubrium, and the xiphoid. So how will you locate the apex heartbeats? First of all, you're going to give me the formula first. All right. The formula is what? Fifth
intercostal
space mid clavicular line. So how would you trace it?
through the sternum.
All right. I need somebody to help me out. If you're so sure of, you're going to straight. Okay. All right.
So you find the sternum, then you find the second rib.
So how are you going to find the second rib?
It's the one right below the clavicle.
But you cannot tell the one right below.
You feel the bump from the middle.
Okay, feel the bump from
the sternum.
sternal notch. Okay, you trace it down, then you feel the bump. So you feel the bump, you trace it left. That corresponds to what rib?
The second.
Second. So
You'll find the second intercostal.
second intercostal, which is the second rib, right?
Yes.
But remember, you're going to stay in the middle of the clavicle. So the second,
And then
third, fourth, and the fifth. Bam. Then you see that. Remember, it's a female. You got to lift up the breast. So you got it as we go around. Very important. Yes. So that we all don't get in trouble. I'm telling you, when as a male OB, when we're dealing with female, we don't go in there by ourselves. We need a female chaperone. Okay, we need a female chaperone so that we can get a witness, just in case somebody wants to pull Morgan and Morgan or not. Yeah. So.
Don't play those games.
No. Because when you have your baby in the hospital, like 2-3 weeks, you start receiving mails. Has anybody received mail like that before? Yeah. Mails.
From the lawyers?
Yes.
Oh,
Yeah, they say maybe everything was all right, the doctor did it right and all that.
My kids had that long ago.
Okay.
They weren't doing that back then.
Right.
What was that before lawyers came
Because
on?
they asking you just in case, then for people that really wants money, they probably start asking questions around, going online. Do you do this, do that, and all that? Maybe kind of dragging a little bit. He's not crawling when he or she's supposed to. Maybe he didn't do something and all that, Because typically, OB doctors, they are still responsible for a child, even I think up to the age of 21. Yeah. Because there are things that is not going to show up at the early stage that might show up later on.
Right.
Okay? Because in children, in pediatrics, you go back to what? To their pregnancy, delivery history.
Yeah.
If nothing was eventful. So it's the uneventful. If it's eventful, question mark. Right? Okay. So very important. Right? So the thing about the bony joint is, with the fibrous and cartilaginous, they can get hardened and become bony. Okay? Very important. All right, the fibrous. The fibrous joint, we also call it synarthrosis or synarthrosis, okay, or synarthroidal, synarthrodial joints. Okay? So what binds them together is collagen fibers. Collagen fibers. That's what binds them together. Two bones. Call it collagen fibers bind them together. Okay? So that's the fibers. Alright? So we have three types. The three types of fibers. We have the sutures. The sutures, we have the gomphosis. Gomphosis, and we have syndesmosis. Okay, sutures, gomphosis, syndesmosis. Syndesmosis. Now the sutures, we already talked about it, okay? Mostly present in infants, all right? So the sutures, they're immobile or slightly what? Mobile. Immobile or slightly mobile, particularly in an infant, so there is immobile or slightly mobile, which means can allow the overlapping of the brain bone so that it can pass through the birth canal. Okay, very important. All right. We can also classify sutures based on how the sutures are locked together, the patterns of the locking, okay, but not so much of a big something. So, well, let's just stay with, let's just describe it anyway. All right, the serrates, when they are locked by what we call wavy lines, wavy, like this. That's serrate suture. All right. An example of that are the coroner, the sagittal, and the lambdoid. So the coroner, sagittal, and the lambdoid. Okay, you can see. So like a wavy, right? The lap, or what we call the squamous suture. They have overlapping beveled edges. So they are not wavy, but they are overlapped. So the edges are beveled. So let's look at it. Okay, the lap. So you can see. So this is overlapping, but they are not wavy like the squamous. Okay, sorry, like the coroner, the lambdoid, and so on. Okay, they are not. All right, or like the sagittal, but it's just something that's we have one this way, so just overlap. So this is one. This one is what we call the squamous suture. As you can see, right? That's the squamous. Right. It's overlapping. Okay. All right. An example of that is temporal and parietal bones. The suture between temporal and parietal bones, which is what? The squamous. All right. The plane or straights. This one is not overlapping. It's just a straight. So look at it. You can see that right here, something is not overlapping, but it's they just like clapping, coming together. All right. Now, the palatine. This is the palatine bone. The palatine bone forms the roof of the mouth. And the palatine, or the palatine is divided into two. The palatine. Okay, so we have the front parts and the posterior parts. The front part and the posterior part, which helps to form the palates. So the palate the structural needs, or this the type of structural needs can be hard or soft. The hard one is in front. Why? Because we do a lot of training and all that. It's going to be able to withstand the resistance. It's just like the squamous suture and the what? The squamous suture and the squamous epithelia and what? What is the other one that has multiple layers? Stratified and stratified. Okay? Because stratified gives what? The resistance so that it can withstand the abrasions. Okay? Alright? So that's the plane sutures. That's the plane suture. So the plane suture, they're just what? Overlapping. So the palatine process of the maxilla. The palatine process of the maxilla. Remember, the lower jaw is the mandible. The upper jaw is the maxilla. Right? The lower jaw is the mandible. And the upper jaw is the maxilla. Alright? The only noticeable movable joints of the skull is what? The mandible. The mandible. The mandible. Okay? Alright. Gomphosis is another type of what? It's another type of fibrous. Thank you. It's another type of fibrous. Gomphosis. We'll talk about it just right now. Okay? The gomphosis is a fibrous joint which helps to provide attachment for a tooth to the socket alveolar process of the maxilla, okay, or the mandible, the gomphosis. So you can see it's actually where a tooth is coming up, all right? The gomphosis, all right? So we have a whole lot of ligaments, That is what? There is getting everything bind there. That is getting everything bind there. Okay? So very important. Very important. All right. The collagen fibers and all that, they are pretty short. They are all attached there. Okay? Now, the thing about it is, because of the periodontal ligaments, it allows the tooth to move a little under stress. Like when we are chewing something. Okay, under stress, a little. Okay? All right. Syndesmosis, which is another type of fibrous. The syndesmosis is when you have two bones, two long bones, but in between them there is a type of interosseous. When we say interosseous, what does that mean? Interosseous or osseous. Maybe I should say osseous. In between bones. Interosseous membrane. So interosseous membrane is in between bones. Interosseous membrane. Okay? So this is it. You can see the membrane. So for instance, the fibula and the tibia. The fibula and the tibia. Right? So which allows for, in the radius and ulna, it allows for supination and pronation. But the tibia and fibula, it only allows for a little movement, not so much of movements. Okay? Alright. So cartilaginous joints right now. Cartilaginous joints. So we've looked at bony and fibrous, cartilaginous. Alright? So for cartilaginous joints, we call it amphiarthrosis or amphiarthrodia. So cartilaginous. Wait. What did I say? Yeah, fibrous. I think, let me go back. I think I probably missed something. Because I put it in a hold on. Press.
That's how it went.
Okay, the fibrous. Okay, the fibrous go under here, not or the fibrous, synarthrosis or synarthroidea. Okay? Guys, you understand what I'm saying?
Okay.
Yes. So let me erase this. I'll rewrite it so that we can get it. So,
Right now.
yeah. So please, if you wrote it in front of the cartilage, because my mind was talking about fibers, but I was writing it under the cartilage. So cartilaginous. So this is where we have amphiarthrosis or amphiarthrodia. Everybody understand what I'm saying?
Yes.
Okay. So let's move on to this. So cartilaginous, another name is amphiarthrosis or amphiarthrodia joints. Okay? Amphiarthrosis or amphiarthrodia. All right. So amphiarthrosis. amphiarthrosis or amphiarthrodal. Amphiarthrodial. Okay? So what binds them together? Cartilage. That's what we call the cartilaginous joints. All right?
I'm a little lost.
Okay.
For a minute here.
All right.
Fibrous goes with.
Synarthrosis
That's what I thought. And
or
then-
synarthroidal. And we have three types of it.
Okay.
Okay? Then cartilaginous goes with or amphiarthrosis or amphiarthrodial.
Gotcha.
Okay.
Thank you.
You're welcome. All right. So the cartilaginous, the two types, we have what? Synchondrosis and symphysis. So two types, synchondrosis, and what? Symphysis. And symphysis. Those are the two types. All right? So the synchondrosis, it is a type of bone that is joined by a type of cartilage that we call iron-link cartilage. Iron-link cartilage. What is an example of that? Epiphyseal plates. Epiphyseal plates. Where do we see epiphyseal plates? Where can we see epiphyseal plates? Long bones. Long bones, good. In the long bones, right? Because that's where it finds the epiphysis and diaphysis. Epiphysis and diaphysis. What are the two types of dwarfism? Two types of dwarfism. Pituitary.
Yeah, and this,
Achondroplastic. Achondroplastic. Pituitary and achondroplastic. So, how will you differentiate a pituitary dwarfism from achondroplastic? Pituitary dwarfism and achondroplastic. In another sense, I'm asking what is pituitary dwarfism and what is achondroplastic dwarfism?
One is
Which one? Okay. Which one is the long bones?
No, for the dwarfs is the dog.
Yeah, they are dwarfism. Yeah, it would mean, huh?
the achondroplastic is a problem with the bone growth.
Okay, but the long bones, they have a normal torso.
Pituitary is a problem with the gland.
Okay, all right, you're rushing me right now. Slow down with me. All right, achondroplastic, they have regular torso, but problem with the long bone, right? Then the pituitary, there is a problem with
the short stem.
the gland, pituitary gland, in which is not releasing the growth hormone. As a result, it's uniform dwarfism. Everybody clear with that? Okay. All right. So, that's an example, all right? Now, the attachment of the first rib and the sternum is also an example, all right? The coastal cartilage joined to the sternum by the synovium. All right, let's take a little bit of slow down here. The first rib and the sternum is an example of iron leg. The first, rib number one. The rest are what? Synovial joints. It's a type of joints. All right, let me put it this way. Rib number one and sternum. The joint is what? Iron leg cartilage. Iron leg cartilage. Okay? Iron leg cartilage. The rests, all the, which means rib number two. Rib number two, this is rib number one. Rib number two, all the way, it is what? Synovial joints. Which is the other type of joint that we said is complicated, more complex. Everybody clear with that?
Yes.
So rib number one is just iron cartilage. Rib number two all the way to rib number seven, because true ribs. True ribs are how many ribs? Seven. Seven ribs. So rib number one, true, is iron. 2, 3, 7. Here is synovial joints. Okay? Alright? So very important. So that is what synchondrosis joint, which is a type of cartilaginous joints. A type of cartilaginous joints. Alright, symphysis. This is when two bones, the type of cartilage that binds these together, they are what? They are fibro. cartilage. Why the other one is hyaline cartilage? Why the other one is hyaline cartilage? Okay? All right? So we have the pubic symphysis, which joins what? The left and the right hip bone. Remember we talked about it? The pubic symphysis. All right? Allows for a little bit of movement for actions and also for baby deliveries. All right? In between the vertebral body, in between this, that is fibrocartilage, that forms what? What is the other name that we call that?
Yes.
Disc or disc. Or disc. Okay? So very important. All right? So the thing about it with the disc is the intervertebral disc, it gives a slight movement. At least sometimes you can bend your spine and all that, slight movements. Okay? So it provides a whole lot of flexibility. All right? A whole lot of flexibility. Okay, synovial joints. This is the guy that is kind of a little bit complex. All right, with the synovial joints. All right, the other name is what? Diarthrosis or diarthroidum. Diarthrosis or diarthroidum. Is anybody in occupational therapy program or physical therapy here? Occupational therapy? Nobody. Okay, all right. Or physical therapy. You thought about it, but you didn't give it a good thought, right? All right. The synovium or diarthrosis or diarthroidum. All right. This is when two joints they are separated by what we call a joint cavity. There is a space between them. Okay. So let's take an example. So let's say we have this joint this way. All right. You all know what I'm drawing when I'm drawing this. So you guys are pretty used to it now, right now. Yep. So I'm not drawing what you guys are thinking.
No.
Thank you. So we have the cartilage, articular cartilage, okay? Then we have what we call synovial membrane, which binds them together, synovial membrane, okay? Then we have our good old what? Bone to bone is what? Bone to bone is what? Ligaments. Ligaments. Bone to bone. Okay? So here we have what? The fluid. The fluid. So we call this synovial fluid. Synovial fluid. Alright? We'll call this articular cartilage. Cartilage. Okay? Why we call this synovial membrane? Synovial membrane. Okay? Synovial membrane. So the joints that there is a cavity between them is the synovial joints, and it has all of those. All right. The thing about the joint is because it's really common. This is the one that sometimes can get infected. Once it gets infected, we can aspirate the fluid. We call it joint aspirates. Joint aspirates. With joint aspirate, we can send it to the lab to what we call microscopy, culture, and sensitivity. Excuse me, and sensitivity. All right? The microscopy means we look at the fluid, we look at it under the microscope to tell what type of microbes it is. Okay? We're trying to look if there is a microorganisms in there. All right? And a lot of the time when the joint is affected, when you touch it, it's going to be febrile to touch, warm to touch. There could be what? A reduction in the movements, range of motion, reduction in range of motion. Okay? So, with the reduction in range of motion, it can affect what? The joints function. All right? The culture, when we take a look at the sample under the fluid to check if there is a presence of microorganisms, then we can culture it also for what? Microbial growth. All right? The next thing is, if there is a positive organism under microscopy and culture, we can now tell what type of antibiotics is going to be sensitive to. That's what we call sensitivity. tests. All right? We usually use a type of disc that we call optician disc, okay, in which we put samples of antibiotics on the disc. Samples of antibiotics. Samples of antibiotics. So here we can say we have something like ampicillin. Ampicillin. We can say we have something like gentamicin. Gentamicin. Okay, we can have streptomycin. Streptomycin. We can say here we have a nalidixic acid. Those are names of antibiotics. Nalidixic acid. Okay. We can say we have here nitro. Actually, let's put something else. Cephalosporin. Cephalosporin. Okay. So we put a sample of the thing in there. It's sample of this aspirates. So the samples are these. The samples are these. The samples are this. The samples are this. After like 48 hours that we place it in incubator, when we pull it out, if there is what we call a clearing zone, sometimes it can be a little bit of clearing zone here. There might not be any clearing zone in all that. It tells us that the antibiotics that we put on the plate is actually restricting the growth of that organism. So, with nalidixic acid and cephalosporin, the one that it clears the most, this is the one that is most sensitive to. Clears it a little bit, kind of works a little bit, but if I'm going to treat this patient, I'm going to give this patient this medication.
Because it cleared it more?
Exactly, it's going to kill it more. All right? Now, if I need to do a dual combination, I can give combination of cephalosporin and nalidixic acid. That's why sometimes patient takes 2 antibiotics for what we call synergistic effect. We call that synergistic effect. Synergistic effect means they are fighting one microorganism together. Yes.
When I was a kid, I had that. My mom didn't know how to describe it to me. So now I know.
Oh.
I couldn't walk for like months. And
Really?
the doctors didn't know what was wrong with me. You know, I got an infection in my
Oh,
knees.
oh, wow.
Yeah.
Hey, Doc.
Huh?
It's good to know you're talking about
Yeah.
fluid on the knee, correct?
I'm sorry?
Fluid on the knee, right?
Yeah, the fluid from the cavity, from the joint cavity.
When I
We
was-
aspirate.
I've had mine drained so many times.
Oh, wow.
Probably about 20 times.
Oh. Okay, but that is something about the synovial cavity or the synovial joints. Okay, all right. So it is most likely to develop a painful something, as we said, can become infected. Anything can happen to it. Very important to physical and occupational therapists and athletic coaches, nurses, and fitness trainers. All right. So their mobility is very important to life because we do all of the fingers, where we do a whole lot of bending. Okay? Sit down. Alright? It's got the articular cartilage, synovial fluid. The synovial fluid is rich in albumin. Okay? What it does is it helps to give a slippery texture between the 2 bones. Okay? It actually nourishes the cartilage and remove waste. Right? So we said it makes what? The synovial membrane to be what? Friction free, so that the articular cartilage is not rubbing on each other. Because if it's rubbing on each other, it can become degenerated. After degeneration, it can now become arthritis or arthritic. Okay?
Yeah, it
All
looks
right.
like glass.
Hmm?
It looks like glass.
Oh wow, wow! It's probably been rubbing on top of each other for long. Okay.
Yeah, I'm talking-
All right. We talk about the synovial membrane, synovial joints. Now, the thing in some synovial joints, the cartilage can grow inwards and form what we call a joint capsule. Forms what we call a joint capsule. All right? There is one that we call articular capsule. We see this in TMJ. But the most obvious one is the meniscus. Then we have what on the knee, what we call the knee pad. The knee pad actually helps for stability. All right? So it helps for stability and also helps to absorb shock and pressure because the knee bears a lot of weight. Helps to stabilize the joint, reduce what the chances of the knee being dislocated. All right, that's the meniscus. It's like a pad, like a moon shield. Okay, we're gonna see. All right, we're talking about tendon. You guys know about tendon. Ligaments, you guys know about ligaments. Bursa is when you have a sac. Let's say we have this muscle right here. Okay, and it joins to the bone through what? Muscle joins the bone through what? Tendon. Now, before the tendon actually joins in there, there is a type of sac here, okay, which fills with fluid. So it actually helps to reduce the irritation of the tendon over bone, so that the tendon doesn't keep rubbing on the bone. Okay? So we call that bursa. Bursa. It's a sac that is filled with fluid. We can see that between muscles or where a tendon is passing over a bone, or sometimes between bone and the skin. In between muscles, tendon passing over a bone, or in between bone and the skin. It's actually reducing friction so that things can pass on smoothly. All right, so it pushes, all right, do a whole lot of things. Now, when we have it in a cylinder, in a cylindrical shape, we call that tendon sheath. Okay, because it's like a cylinder, something like this, which wraps around a tendon. It wraps around a tendon. All right, we call that tendon sheath. Okay, so we see it in what? In the hand and in the foot, because the hand. Think about it. We have a whole lot of muscles that actually get locked in the hand. Remember when that guy did the dissection, you can see a whole lot of tendons going there. Then he was able to move it. Okay? So all those tendons that are going in over the carpal bones, the carpal bones or what? What do we call them? The carpal bones or the wrist bone. Thank you, or the wrist bone. Okay? So it kind of passes over that to reduce the friction, which is very important. Okay? So that's, you can see the bursa. You can see it wraps around all of these tendons and it's going into the fingers. You can see the same thing here, because this tendon is going to terminate at the distal phalanx, right? Distal phalanx. Okay. All right. So there's something about synovial fluid. Exercise helps to warm up the fluid. In warming up the fluid, it becomes less viscous. Then the cartilage can absorb them, which because it helps to support cartilage. Exercise, all right? Very important. If we are doing a repetitive compression, particularly around the area that doesn't have a blood vessels with the cartilage during exercise, so it's going to squeeze the fluid and metabolic waste out. Remember, the synovial fluid nourishes and helps to remove waste in the joints, in the synovial joints. Okay? So we really move the weight and all that, so kind of helps to makes it much more to take in oxygen and nutrients. So warming up, exercise warms up synovial fluid, which makes it much more effective. All right? So that is why if we don't exercise, the cartilage deteriorates because the synovial fluid, they don't get to warm up. They don't get to warm up. Okay? They don't get to warm up. All right? As a result, it can degenerate easily. All right? Joint nervous system. No, we don't need this. Okay? Mechanical labels and all that. So, all right, the range of motion. The range of motion, this is very important, particularly for those in the RN program, or those in the physical therapy, and we don't have anyone here, those in occupational therapy. When you come to when your patient is getting out of surgery, like maybe orthopedic surgery and all that, so the physical therapists, they have to perform a whole lot of range of motion to see how much it can move the joints, or to what extent it can move the joints. All right? So very important. So helps to do what we call the physical assessment of joint flexibility, range of motion. All right? Now, for those joints, we have to know what is it that they can do for us to know how far they can go. For instance, my elbow, if you're going to do range of motion for my elbow, you're trying to push it backward. No, it doesn't go backward. Does that make sense?
Yeah.
Right. So you have to know the extent to which those things can go. All right. So let's take a lunch break. We'll come back 11:25 so that we can finish this up.
I'm gonna run that.